Leptospirosis, caused by bacteria of the genus Leptospira, was first observed in the late 19th century. The disease was first described in 1886 by Adolf Weil, a German physician, who reported an acute infectious disease with enlargement of spleen, jaundice, and nephritis, which later came to be known as Weil's disease, a severe form of leptospirosis. However, the causative organism itself, Leptospira, was not identified until 1907. It was first observed by two Japanese researchers, Ryokichi Inada and Yutaka Ito, in association with their colleagues Kotaro Noguchi and Kiyoshiro Kakubo. They were the first to isolate and cultivate the bacterium, which they named Spirochaeta icterohemorrhagiae, later renamed Leptospira interrogans Saravar icterohemorrhagiae. This discovery was a significant milestone in understanding and diagnosing the disease. Leptospirosis is a bacterial infection primarily contracted through exposure to water or soil contaminated with the urine of infected animals. The bacteria, belonging to the genus Leptospira, can enter the human body through cuts, abrasions on the skin, or the mucous membranes of the mouth, nose, and eyes. This mode of transmission is particularly common during activities such as swimming, wading in floodwaters, or engaging in water sports in contaminated areas. In addition to environmental exposure, direct contact with infected animals is another significant route of infection. Individuals who work closely with animals, such as veterinarians, farmers, and slaughterhouse workers, are at a higher risk. This direct contact can involve handling the urine, blood, or tissues of animals carrying the bacteria. While less common, ingestion of contaminated food or water is also a potential route of infection. This can occur if food or water sources become contaminated with the urine of infected animals. Inhalation of aerosolized droplets containing the bacteria, though rare, has been documented as a means of contracting leptospirosis. This might happen in situations where contaminated water becomes aerosolized, such as in certain agricultural or industrial settings. It's important to note that person-to-person transmission of leptospirosis is extremely rare. The risk of contracting the disease is generally associated with occupational exposure, recreational water activities, and exposure to floodwaters or contaminated environments. To reduce the risk of infection, preventive measures such as avoiding potentially contaminated water or soil, wearing protective clothing, and maintaining good hygiene are recommended. Leptospirosis, a bacterial infection caused by the Leptospira genus, manifests a range of symptoms that can often be mistaken for other diseases. The incubation period varies, typically spanning from 5 to 14 days, but it can range from as short as 2 days to as long as 30 days. One of the first signs of leptospirosis is usually a sudden high fever, often accompanied by severe headaches and chills. Muscle aches are also common, particularly in the calves and lower back. A distinctive feature of the disease is conjunctival suffusion, which is characterized by redness of the eyes without pus or discharge. Gastrointestinal symptoms, including nausea, vomiting, and sometimes diarrhea, can occur. In more severe cases, the disease can cause jaundice, a yellowing of the skin and eyes, indicating liver involvement. Some individuals may develop a rash and experience abdominal pain. General feelings of fatigue and weakness are also common. In its severe form, leptospirosis can lead to serious complications such as Weil's disease. This more severe manifestation can result in kidney damage, liver failure, meningitis, inflammation of the membrane around the brain and spinal cord, respiratory distress, and in extreme cases, death. Given the variability and potential severity of symptoms, it's crucial to seek medical attention if there's a suspicion of having contracted leptospirosis, especially after exposure to conditions that increase the risk, such as contact with contaminated water. Early diagnosis and treatment with antibiotics are key to effectively managing the disease. Leptospirosis is treated primarily through the use of antibiotics, with the approach varying based on the disease's severity. Early diagnosis and prompt treatment are crucial for effective management and reducing the risk of severe complications. For mild cases of leptospirosis, oral antibiotics such as doxycycline or azithromycin are typically prescribed. These are effective in targeting the Leptospira bacteria and are usually taken for about a week. In more severe cases, especially when the disease progresses to involve organ systems, a condition known as Weil's disease, intravenous antibiotics like penicillin, ceftriaxone, or cefotaxime may be required. These stronger antibiotics are administered in a hospital setting where the patient can be closely monitored. Supportive care plays a vital role in the treatment of leptospirosis, particularly in managing symptoms and preventing or addressing complications. This includes ensuring adequate hydration to combat the effects of fever, vomiting, or diarrhea, and providing pain relievers to alleviate muscle aches and pains. In cases of severe illness, hospitalization is often necessary to provide comprehensive care, which may include intravenous fluids, medications to support organ function, and treatments for specific symptoms. For patients with complications such as kidney or liver damage, the treatment becomes more complex. This might involve dialysis in cases of kidney failure or specific interventions for liver or respiratory complications. In a hospital setting, additional care is also taken to prevent secondary infections, which can occur in patients with severe illnesses. Ongoing monitoring is essential to assess the patient's response to treatment and to manage any complications that arise. Even after recovery, follow-up appointments may be necessary, particularly if there were significant complications during the course of the disease. Preventive measures are also important, especially in areas where leptospirosis is more common. Avoiding contact with potentially contaminated water, using protective clothing, and maintaining good hygiene can help prevent infection. Given the variability in symptoms and potential severity of the disease, consulting a healthcare provider for a proper diagnosis and treatment plan is essential if leptospirosis is suspected.